then I start. You sure want to start continue? Okay. Just in case you've realised, we are just starting the talk. So we have SJ that's going to start talking to you about physiotherapy. So hopefully I'm going to send her picture to you. Bear with me. I'm sorry if you are listening. So I think I'm going to send you live now. You are now live.
Excellent. Okay. Hello. Hi. So my name's SJ. I'm a physiotherapist, and Miss Rance has asked me to do a talk just to kind of tell you a little bit about what I do, what happens in the hospital with regards to physio, and then we'll have a little chat about kind of things that you need to do in school and in university and things like that to kind of, you know, pave your way to becoming a physio. And then if you've got any questions, you can just pop them in the chat and I'll try my best to answer them as much as possible. So, right, I will share my PowerPoint with you. So we'll do that. So there we go. Right, so this is me. Hi. This is my uniform that I wear at work. So you can tell physios normally in the hospital we wear a white tunic or a white polo top with blue edging. So as you can see on my top on there, some blue edges on the top there. And we've got this badge here. So that badge on my chest is the Society of Chartered Physiotherapists. So that's how you can tell who we are. So there you go, that's me. Right, so what we're going to go through. So a little bit about me. So like I said, my name's SJ. I work in Bangor in Ysbyty Gwynedd in North Wales in the Betsy Cadwallader Health Board. So that's me up there in Gwynedd. So a bit far away from you guys. So I've been working as a physio for about 2.5 years now. I studied in Brunel, which is in West London, before I moved up to North Wales. Before I was a physio, I worked as a sports therapist and a personal trainer, and I worked in a local gym and then alongside a local rugby team. So this is some pictures of me working alongside my rugby team there. So I used to do some kind of injury management. So if many of the rugby players got injured or anything like that, I'd be on the side there helping kind of pack injuries and stuff like that. And then if there was any long-term injuries, I'd kind of help them get back to playing that way as well. So I have kind of always known that I've wanted to be a physio. My mum's a physio as well, so it runs in the family. I really like learning about the human body. I love understanding kind of how injuries affect us and how we can kind of help make them better through kind of exercise and things like that. So I think that's why I became a physio. Right, so what do physios do? Good question. So we help restore movement and function for people who've had an injury, an illness, or a disability. So it might not just be people who've been hurt kind of on the rugby pitch or running or falling over, but it could be someone who's got sick, kind of long-term sick. We can kind of help them get back to doing what they did before. And then people who've got long-term disabilities, so things like cerebral palsy, which you are born with, or long-term neurological conditions like Parkinson's or multiple sclerosis. So we do a lot of stuff. So this is just an example here. So we help these people through movement and exercise, manual therapy. So that would be things like massage or trigger pointing and things like that. And then a lot of education and advice to help them kind of get better. A big thing for us is we work with people of all ages, so not just adults. We work with the elderly, we work with children, and we help them to kind of manage their pain and help prevent further disease. And then the last thing and the most important thing for us is trying to encourage self-management and help people kind of manage their conditions on their own rather than continually coming to physio. So we're all about encouraging patients to take control of everything that they have going on in their life and try and continue without physio in their life as much as possible. So we try and promote independence. Right, so what we do in hospital, there's a lot. Here we go. So musculoskeletal to start with. So musculoskeletal is kind of what you would consider as normal physio. So we, as MSK physios, will look at patients with kind of pain issues. So say, for example, you twisted your ankle or you got a bad back or something like that. We help kind of manage that through a lot of exercise, through, like I said, manual therapy, so things like massage and stuff like that, acupuncture, ultrasound, things like that. So really varied. You get to see a lot of things, a lot of specialist areas, so things like the spine, or you can get hand physiotherapists, so people that deal specifically with hand injuries and stuff like that. So it's quite varied, quite a broad spectrum at the moment with regards to MSK. Next one, so neurological. This is my favorite. This is what I want to specialize in. So neurological, again, is very broad. So for example, this man here, I think he's had a stroke. So with regards to neurological, we get patients trying to regain their function. So with regards to things like a stroke, is an injury in the brain. So where they get a clot or a bleed on the brain, and what happens is that area of that brain actually dies, and we kind of lose that function of that area. So with physio, what we try and do is we try and rebuild the pathway. So our brain is really clever, and actually what it can do is it can make new pathways and new roads, like we do all the time on the roads. You know, in Britain, they build new roadworks, they make new roundabouts and new lanes and things like that. The same thing happens in our brain. So physio can help us regain that movement and that structure. Other areas that we can work in, Parkinson's, so chronic conditions like that, Parkinson's, multiple sclerosis, motor neuron disease. So these are all kind of long-term conditions that affect patients throughout their life. Other things that we can work in, like I said at the start, cerebral palsy, so in pediatrics and then through into later life. Spinal cord injuries and brain injuries are another big area. So again, trying to rebuild those pathways, getting patients used to things like wheelchairs, getting used to them kind of doing things that they might not have done the same way before. So it's occasionally with patients who have like a spinal cord injury, for example, they might lose function in one area of their body. So for example, if they had an injury in their back, they might lose function in their legs downwards. So we kind of help give them the tools to function normally, or as normally as they can do with the kind of tools that they have available. So they might not ever regain the use of their legs, but we can help them to kind of move further on and maybe be stronger in their upper body, be able to kind of move about with their wheelchair, or you know, move about on the floor and things like that, where they can use their arms and stuff like that. So neurology is the next one. Right, respiratory, the gory side of physio that people quite often don't enjoy, but I think it's also quite interesting. So respiratory physio is kind of the one that people don't really associate with physiotherapy, but actually it's super important. As respiratory physios, we help patients who have chronic lung conditions. So things like COPD, which you get in your lungs if you smoke a lot. So you get damage to the lungs, and what happens is that your body produces a lot of phlegm, and your body is not able to kind of clear it as well as normal. So your lungs don't actually function as well as they would in, say, you or me. And what we do as respiratory physiotherapists is we help the patient to clear those secretions, help them clear that phlegm. Bit gross, I know, but what we do is a lot of things like manual techniques. So we'll do some kind of shaking of their lungs. So we'll hold on to their rib cage and kind of give them a good shake about, or kind of give them a good little bash, get those, you know, get that phlegm away from the side of the lungs, and then we'll help the patient with their coughing. Another area that we work in, as you can see in the picture here, so this lady who's lying in the bed, she is in intensive care. So the tube that's over her face on her mouth, that's what we call an ET tube, endotracheal tube. So patients who have been in serious accidents or have been very unwell, they might not be able to breathe for themselves, or they might have had surgery that requires them to have a really, really deep rest. So these patients won't be able to breathe for themselves. So what happens is that the doctors will put a tube down into their lungs, and this lady here has that, and what it does is it breathes for them. And so as physios in intensive care, we help manage their chest. So because their machine is breathing for them, they're not doing the normal things that our lungs do. They're not clearing that phlegm. They're not coughing as normal. So we as physios, we can go in and we help again with those techniques. So shaking their rib cages, getting them, moving them about in the bed if they're, if they're asleep, things like that, trying to get that phlegm out. And then another thing that we do, which is a bit gross, we put a tube down into their lungs and we can suck all that phlegm up. So it's called suction. So we get samples of phlegm up, so help with the doctors with identifying things like lung infections and stuff like that. So we're quite a handy bunch in respiratory. And then outside of intensive care, respiratory physiotherapists can help with, again, long-term lung conditions. So things like teaching patients how to use their inhalers, for example. So if any of you have asthma, it's quite a good one to learn how to use your inhaler correctly. So physios might teach you how to do that. Or if you have a long-term condition like cystic fibrosis, where your kind of ability to clear your lungs is not as good, we'll teach you some techniques, so some breath holding techniques and stuff like that will help you to clear those. So quite an important role of physio-respiratory. Right, next one. So cardiopulmonary, so your heart. People who have an unhealthy heart, so for example, if they've got a lot of cholesterol, or if they've got some clots or things like that floating around their body, they are at a high risk of a heart attack. Or patients who have had a heart attack, physiotherapists can help them with their rehab post-event, so post-heart attack, or if they had, a bit of angina, which is like a mini sort of heart attack. It's kind of like a little blocking of a blood vessel, but not a big one. So we can help with this by kind of building up their exercise tolerance, so getting them a bit fitter, getting them a bit stronger. This man in the photo here is on oxygen, so that's quite a common thing if people are, with heart conditions. Quite often you'll find that their kind of lifestyle might not be very healthy, so they might have lung conditions as well. So we link in again with that respiratory, so managing their respiratory side of things as well as their heart side of things. So the two that we just spoke about, so the respiratory and the cardiac, kind of follow very closely together. The two link very nicely together. Right, next one, pelvic health, bit weird. So pelvic health, very important, like you think in women who've just given birth or are pregnant, but also very important for men. Pelvic health physios, or sometimes called women's health physios, they deal a lot with things like incontinence. So incontinence is where you are, you have accidents where you find like you're going to the toilet without realizing it and things like that. So a lot of focus on your pelvic floor muscles, so the muscles that help you control your bladder and your bowels. A lot of postpartum women, so women that have had a baby but are really struggling to regain the strength in their pelvis. So that's kind of what those pelvic health physios do. And as well as that, sometimes men and also women issues with kind of sexual health and stuff like that. Again, pelvic health physios will help in linking with that. So it's all about that muscle control within the pelvis itself. Pediatrics. Okay, so this is a fun one. So peds is really great if you love to play. Pediatrics is very broad. Like I said at the start, cerebral palsy is a big one. So cerebral palsy is basically where within the uterus or just after birth, a baby will have some kind of brain damage. So it might be because of lack of oxygen to the brain, kind of from the umbilical cord possibly being occluded, or sometimes it can get wrapped around the baby's neck, or there could be some kind of difficulties within the womb, within the uterus when the baby is being, developed. But what happens is that it's essentially a baby stroke. So the child will have some difficulties, might have some kind of developmental issues, might have some physical issues, other things, children with things like Down syndrome and stuff like that, learning difficulties, things like that. So physios help with baby development. We help with teaching parents how to learn to kind of play with their children in a way that can kind of develop their progress. So especially with cerebral palsy children, they might not walk until very, very late. So things like giving them little special shoes and special splints on their legs to kind of ensure that they're able to walk and run and play as much as the other children kind of in their age group. And then some kids that if they aren't able to walk, even when they're later on in life, we kind of look at their wheelchairs again, having a look at getting them as kind of mobile as they're able, and making sure that they're able to be as functional as possible throughout the rest of their life. So that's that one. Okay, oncology. So oncology is cancer care. So cancer care is a really important thing, and it kind of links in a little bit with palliative care. So palliation is where a patient has a condition that is going to cause their life to end. So it's an end of life condition. So oncology and palliation are very closely linked, because patients who have cancer or who have a condition that is going to cause end of life quite often experience a lot of pain or kind of a reduction in their movement. So patients who are on things like radiotherapy and chemotherapy, it's very tiring, and it can cause a lot of weakness, a lot of fatigue. And with physiotherapy, we kind of try and rebuild the patients, try and get them back on their feet as much as possible, because obviously they have a lot of things going on in their lives already, and they've got this, if they've got cancer or if they've got something that is causing end of life, they have so much going on already that, a reduction in their mobility is kind of just another thing that is going to be just making their life really difficult. So from our point of view, oncology and palliation is really, really important to try and get patients as mobile as they can be, so that they can be at home, so that they can have kind of the life that they want before their life is going to end. So oncology and palliation is a really, really great area of physio that kind of is overlooked a little bit. I think more people should get into kind of palliative care. Next one, right, A&E. I bet some of you have broken a bone before or twisted an ankle and gone to A&E, and they took an X-ray and they showed you your bones and they were like, you broke it. So then they put you in some plaster and you went home, and then when you came out your plaster, you probably went to go and see a physio. But now a new thing that we've started is you can see physios straight away in A&E. So physiotherapists have started taking over initial kind of soft tissue injuries in accident and emergency. So like I said, if you twisted your ankle or you'd injured your knee or your shoulder, things like dislocations, stuff like that, you might see a physiotherapist in the emergency department. And then also not so much with younger population, but with the older population. Things like people having falls. So the elderly population, falling is a really, really big thing, because it can kind of really set back someone's confidence if they've had a fall, especially if they're elderly and their mobility isn't good to start with. So physiotherapy in the emergency department is really great, because we kind of provide a service where we can kind of try and give someone who's elderly a bit more confidence back on their feet, which might mean the difference between them having a night or a couple of nights in hospital, or them being able to go home straight away if they have had a fall and they aren't injured. So this is a really, really important one as well. So trying to stop patients coming into hospital that actually don't really need it, but might just need just that little bit of a boost of confidence before they go home. So that's that one. Right, trauma and orthopedics. So this is the one, you've broken your leg and you've done a really good job of it, and it's kind of bones sticking out everywhere, and the surgeon comes in and he goes, oh, we're going to have to fix that. So you have to stay over in hospital, and they've got to put some pins in your body, and they've got to screw all your bones back together. And and you'll have to stay in hospital for a couple of days, and you'll see the physiotherapist after you've had your operation. So in trauma and orthopedics, we are not particularly liked by the patients, because as soon as you come out of the theatre, we are right there getting you out of bed, getting you on your feet and getting you going. So T&O is really, really important, getting patients home as soon as possible. So teaching you how to use crutches or a Zimmer frame or anything like that. Teaching you, if you're in, for example, this lady here is in a brace. So explaining to you kind of what your brace is doing. So for example, this lady's brace here is quite a common one. So she's probably had an ACL reconstruction. So something in her knee has gone and they've basically repaired a ligament in her knee. And quite often braces for things like that will kind of limit the movement in your knee. So explaining to patients what that brace is doing and how far your knee can bend and how far it can't bend, because there's quite often a lot of post-op instructions that the surgeon kind of comes along to your bed and goes, right, you can't do this, you can do this, off you go. And then you're like, wait, what? I don't understand what you said to me. So physios are there to explain to you what you can and can't do, and kind of try and make it a bit more understandable, what you can and can't do. And then they'll follow you up with linking in with the MSK physio, so the ones I spoke about first, you'd go and see them afterwards. So that's kind of how those two link in. Community rehab. So this one is more based with the elderly population. So you remember that, you know, that elderly lady or gentleman that came into A&E and they'd had a fall, and they were a little bit scared. And before they came into hospital, they were, you know, they were walking about fine. They didn't need a Zimmer frame or they didn't need a stick, but they had a fall and they didn't break anything, but they're just a bit knocked back on confidence now. And they've kind of stopped going outside and they're working with a frame now in the house, and you know, they're a little bit more reclusive, and they're just a bit worried about walking around. So this is where community rehab comes in. Community rehab is there to help get people back on their feet that kind of necessarily aren't able to come into musculoskeletal sessions, for example, or their physiotherapy needs are more based around the home. So confidence on going up and down the stairs, or being able to get in and out of the bath, or being able to get in and out of the shower, or kind of being able to get outside into their garden. So community rehab is really important in trying to make sure that the elderly population especially are as independent as they can be, because things like falls can make people become very, very scared. I've seen people who've had a fall and they've gone from being very, very lively, very, very bubbly, very outdoorsy, you know, an 80-year-old lady or man that's quite happy to go outside, doesn't need any walking aids, and then they have a fall and they become very scared. They don't go outside, they stay inside, they get their food delivered to them, they don't go to the shops, they don't see their relatives, they don't see friends, and it can become a really big issue, and it can lead to this isolation. It can lead to them deteriorating physically. So community rehab is really good at getting kind of the elderly population specifically, making sure that they're fine on their feet, making sure that they've got that confidence to go outside, and things like that. So community rehab is really important. That links in again with care of the elderly. So care of the elderly is great. It's a really broad spectrum. Obviously it is the elderly. So normally they say on a care of the elderly ward or a COTI ward, they'll say patients of kind of about 65 and over. 65 is not that old, but there are some 65-year-olds that might be very, very frail, but you might get some 90-year-olds that could probably run rings around me. So it just varies. But care of the elderly, again, is just making sure that they've got the independence to do as much as they can on their own. I like working with the care of the elderly because quite often they've got some really good stories and they've got really great sense of humor, and they don't really care what you say because they're like, you know what, I'm 90, I'm not going to listen to you, I'm going to do what I want. So care of the elderly is one of those places where you can have a good time, and they really appreciate it. So again, it's just trying to make sure that they're as functional and as strong and as possible as they can be. And then last one, sports injuries. So this is again kind of like the quintessential classic physio. So this is what I used to do before I trained as a physiotherapist when I was a sports therapist. All elite teams will have a physio on their team. You're there to kind of assess injuries, so linking in with that musculoskeletal, so diagnosing injuries. If like a player's, I don't know, been tackled and they've hit their knee, or someone's slid into their knee, the physio is going to be there to kind of have a look and decide whether they think that it might warrant an X-ray, or whether they think it might warrant, you know, going to the hospital for an MRI or something like that. And then if there isn't anything really, really major, it's kind of trying to rehab them back and making sure that that player is ready to go back to sport. So that's a really key thing with sports injury physio. It's about making sure that the players are all tip-top condition and are able to play as well as they can do. So what do you think it takes to be a physio? So there's a lot of things about physio that's really important, but I think the most important thing for physiotherapy is communication. It's all well and good being super smart and knowing everything that the book says, but if you can't talk to someone, and if you're not comfortable to have a conversation with someone, be it another patient, or be it an occupational therapist, or the doctor, or the nurse, or even, you know, the patient themselves, you need to be able to explain tests and findings of tests, because if I'm honest, doctors are terrible at explaining things. So quite often it's either down to the nurses or the physios to just kind of, you know, re-explain what happened, because the doctor will kind of roll in with his group of other doctors and he'll be like, yeah, this is what happened to you, and then he'll roll back out and you'll be left there without no idea. So yeah, it's really great for you to be able to kind of just have a chat with someone. So just being friendly, being smiley, being able to articulate your words, and just being able to kind of just be really approachable. This builds straight into interpersonal skills. So like I said, being able to build that rapport with patients and colleagues, knowing how to kind of modulate the way that you are with people. So obviously me as a physio, I will be very different if I'm working with, say, a patient who has got, you know, like I'm working with like a 90-year-old deaf lady that's kind of broken a hip or something like that. The way I am with her is going to be very different to the way I am with the 16-year-old on the ward that, you know, broke his leg in a you know, I don't know, football accident or something like that. So it's just kind of managing the way that you are with people and kind of being able to read situations and be able to kind of build those rapports with patients as well as with your colleagues. Team working, super important. You will not ever really be working alone in a hospital. It just never happens. In MSK, you might work alone a little bit, but I mean, you're going to have to bounce ideas off each other. You're going to have to work with other kind of areas of the whole MDT. So MDT is multidisciplinary team. So that's what happens in a hospital. We've got, you know, like I said, we've got the nurses, we've got the doctors, you've got pharmacists who do medication, you've got healthcare assistants, so they work closely with the patients and run under the nurses. You've got your occupational therapists, speech and language therapists. There are hundreds and hundreds of people in hospital. So if you can't work together with someone, then you're going to be a sticky wicket from day one, because people are not going to like you if you're not able to work as a team. So team working is really, really important. Problem solving skills. So this is a great one. And sometimes I have patients that I see and I'm like, oh my gosh, I don't know what I'm going to do with them. And I don't know what is wrong with them. And I don't understand why none of my, you know, my therapies are working. So it's good to have a sit down and have a little bounce of ideas off other physios, and then kind of just think, what haven't I tried, or what could I try differently? And it's just about having a go. Like I think with physio, it's just a bit of trial and error. Sometimes two patients might have the exact same issue wrong, but one thing that you go with might work really well with one person, but will just not work with the other. So it's just about trying to think on your toes and just being flexible and being a bit inventive with kind of things that you want to do. So sometimes it's just like having a play, seeing what works. Patience and empathy. Yeah. Like I said, especially with patients in hospital. Being in hospital is horrible. If you've ever stayed a night in hospital, or more than one night in hospital, it's not nice, especially in this current environment, because people aren't really allowed to visit their loved ones at the moment. So kind of the staff of the hospital kind of become your like link between family. So if you're not going to be patient with people, and you're not going to have that empathy, then your patient is going to really struggle to trust you. So if you can build that rapport with them, build that relationship that is there, that the patient trusts you, then you're like 50% there already. If the patient trusts you, then you're onto a winner. So it's just about having that patience and that empathy to be able to kind of, see it from the patient side, and see maybe if they aren't listening to you, or if they're like struggling with you, or you kind of don't get on well with that character. Just see it from their side. They're away from home. They're probably in a bit of pain. They're probably in a bit of discomfort. They're probably a bit scared. So, it's just having that empathy there. And then, oh yeah, motivational skills. Okay, so you will find some people that will not want to do anything that you want to do with them, like anything. I have people, I walk onto a ward and people like look at you and they know that you're a physio, and then they just close their eyes and turn their head away from you, like, don't come to me, don't come to me, don't come to me. So motivation is huge. Like physios, we are well known for being bouncy, bubbly, annoying people that just are like, come on, you can do this. So yeah, we're here to empower patients, get them to do things on their own, becoming as independent as possible, and just kind of being that person that just goes, you know what, you can do this. I believe in you. Even if the patient doesn't believe in themselves, you need to believe in the patient. You need to believe that they can do whatever it is you're asking them to do. Because if you don't believe that they can do it, then why are you asking them to do it in the first place? So that's really key. And then the last one, time management skills. I am really bad at this. You're going to have a lot to do. Like, it's a busy life. As soon as you come into the hospital, there's always new patients to see. There's always old patients to see. There's always doctors to speak to. There's always other therapists to speak to. There's lunchtime that's so important. There's so much. There's panad time, because, you can't not have a cup of tea halfway through the day. So there's so much to kind of manage your time with, that time management skills is really important. You just need to be able to prioritize your time, prioritize who you're going to see, what you're going to do, and just making sure that you're able to kind of spread your caseload out and not end the day frazzled and stressed because you were like, oh my God, I didn't see this person, or oh my God, I didn't do this, or oh my gosh, I didn't do that. It's just taking that time. And I think if you're going to apply for physio, this is quite a big thing that I would make as a key point to people that you're applying to, that you have got good time management skills, and kind of demonstrate that, or use a like an example of something that you've done that includes time management skills, because it's so important in hospital, because you just get pulled hither and thither all the time. So super important. And then the last thing, how do you become a physio? So these are kind of the normal prerequisites for physio. So ideally 5 GCSEs, A to C grade, or something like a BTEC. Ideally, they would like you to have some kind of science at GCSE, and then English and maths as well. And then A-level wise, 2 or 3 A-levels, ideally some kind of biological science, so biology, or like, I don't know, anatomy or something like that. And then or PE. So what did I do? Biology, PE, maths and chemistry as my 4, but yeah, biology is the good one. Basically, they like some kind of biological science, some kind of science that makes you aware of the human body, basically. And then when you get to university, it's a 3-year degree for an undergrad. So I did what is called a postgrad. So I have done a master's in physio. So I did it as a 2nd degree. So if you're going to do that, you can get a degree before, and then you move on to do the second degree. But if you're going to go straight from school, it's a 3-year degree. There are 3 in Wales, 3 universities in Wales that offer the course. So you've got Cardiff, Bangor and Glyndŵr. So Glyndŵr is in Wrexham. And in Wales, you're quite lucky actually, because they will finance your degree with the prerequisite that you work 2 years in the NHS in Wales. Whereas in England, they no longer fund the physiotherapy course. The NHS no longer funds it. So you will have to fund the course yourself. Whereas in Wales, they will fund it for you if you work 2 years in the NHS in Wales. So that's quite nice. Obviously, each uni has its own entry requirements, so just check online. So if any of you are applying to universities now or anything like that, just have a look at the university themselves and then see what they've kind of got as their entry requirements. And then other things, so work experience is a big thing. So definitely either working in a sports setting, so following, say, a sports therapist or a physiotherapist that works with a team, or in some kind of sporting setting, doesn't matter what, or then working in a clinic. So it could be private, it doesn't have to be the NHS. So yeah, any kind of clinic is fine, or then shadowing in hospital. Physios are always more than happy if you contact a physiotherapy department. Always more than happy to let people come in and shadow. Sometimes schools do it, so I don't know whether there's an option for schools. I'm not sure at the moment what kind of the options are with the COVID pandemic at the moment. There may be some options for things like teaching. So this could always be something that you could put on your, your application, that you had a talk from a physiotherapist and you kind of had some information on it that way. So that's always good as well. And then I just put key attributes. So like I said at the start, it doesn't matter how clever you are, and it doesn't matter what your grades are really. Physio is such a hands-on and caring profession. And I think if you're going to apply for physiotherapy, showing that you have an understanding of what the profession is, but B, you have that aptitude to be a caring, understanding, hands-on person that is a good team worker, that has good communication skills, and that you are willing to go above and beyond for the patient. That is so much more important than whether you have an A-star grade. Like obviously having good grades is good, but being able to demonstrate that you are a willing, caring person that is going to be there for that patient all the time, that's the key thing. That is what is important, and that is what is going to make you stand out from the other applicants, is that you demonstrate that you are willing to do that for the patient. So just added this in at the end. I think it's a really nice saying for physiotherapists, that they say that doctors add life to years, add years to their life. So doctors are the ones that will make you better, but the physios are the ones that will kind of get you back to life. So we're the ones that are going to bring back your independence. We're the ones that are going to bring back things that you can do. So adding life to years, not just years to your life. There we go. Stop sharing my screen, and then I can answer some questions if anyone's got any. Oh, you're muted again.
Yeah. I'm getting good at this. So thank you so much, SJ. I've just been looking, and I think you must have covered everything that could have come up on the questions. So there are no extra questions, and I'd like to give you a massive thank you. I've learned so much about the physios, and I know now why a lot of patients when I was on ward would often pretend to be asleep when we saw the white tops coming in.
It happens all the time.
It explains so much. Okay then, so if there's no questions that there are left, go on, sorry.
Like thinks of any afterwards, they can ask Ms Rance and she can pop me a message, and I'll answer any. If anyone's got any they don't want to put there, that's fine. I'm happy to do that.
No problem. Thank you so much, and I hope you enjoy the rest of your evening, everyone.